Welcome back to Deep Dive, daily dose of case discussions from Medvarsity. Get ready for a deep dive into two urgent medical situations, flail chest and cardiac tamponade.
Sounds good.
We'll unpack exactly what these conditions are,
Okay.
why they're so dangerous,
Right.
what can be done to help.
We're going to explore the mechanisms at play, from fractured ribs behaving unexpectedly
Oh, wow.
to the heart being squeezed within its protective sac.
Okay.
By the end of this, you'll not only understand the terminology, but also grasp the urgency and seriousness of these situations.
All right, let's start with flail chest.
Okay.
I've heard it described using a fence analogy, but can you break that down for me?
Absolutely. Imagine a section of a fence that's broken in multiple spots.
Right.
It swings freely
Uh-huh.
and moves opposite to how it should.
Oh.
That's similar to what happens with flail chest.
Okay.
Multiple rib fractures create an unstable segment in your chest that moves paradoxically during breathing.
Paradoxical movement. That sounds almost counterintuitive.
It is.
Why does the chest move inward during inhalation?
Instead of expanding outward on inhalation,
Right.
that flail segment collapses inward. Think about it.
Oh.
The pressure from the air you breathe in
Yeah.
pushes on the injured area, causing it to sink in.
Oh.
And this is a major problem because it hinders lung expansion
Okay.
and can even cause further damage to the lungs.
Oh, no.
We call that a lung contusion.
So it's not just about the broken bones.
No.
It's the impact on breathing and the potential for those lung contusions.
Exactly.
What are some of the red flags someone might notice if they suspect flail chest?
You'll definitely see that paradoxical chest movement,
Yeah.
the inward movement of the chest wall during inhalation.
Okay.
There will likely be bruising and swelling over the area,
Right.
and the person will have difficulty breathing.
Makes sense.
Sometimes you can even feel a crackling sensation.
Oh, really?
It's called crepitus
Okay.
when you touch the area because of the fractured bones.
Okay, so you've got these clear signs of trauma,
Right.
breathing difficulty.
Uh-huh.
This is screaming emergency, right?
Absolutely. Flail chest often requires immediate intervention to support breathing.
So waiting and seeing is not an option here.
No, not at all.
So walk me through that intervention.
Okay.
What needs to happen quickly?
First and foremost, we need to manage the pain,
Okay.
often with something called an intercostal nerve block.
I see.
It's a procedure where we inject anesthetic around the nerves
Okay.
that supply the ribs, numbing the area.
That makes sense. And I imagine oxygen is key as well.
You're right. Supplemental oxygen is crucial to help with breathing.
And frequently rapid intubation is needed.
Yes,
This involves inserting a tube into the trachea to ensure the lungs are getting enough air.
that's right.
Intubation is pretty serious stuff.
It is.
What factors go into deciding when that step is necessary?
It's a judgment call based on several factors.
Okay.
The severity of the flail chest, the patient's age, and whether there are other injuries or medical conditions present all play a role in the decision.
Now, I know you mentioned an intercostal nerve block.
Yes.
What about surgery? When would a procedure like rib plating come into play for flail chest?
That's a great question. Rib plating is a surgical procedure
Okay.
where the fractured ribs are stabilized using metal plates and screws.
I see.
It's not always necessary,
Right.
but in cases of severe instability or persistent lung problems, surgically fixing those ribs can be incredibly helpful.
Wow.
It stabilizes the chest wall and offers better protection for the lungs.
Okay, so we've covered the basics of flail chest, what it is, why it's so dangerous, and how it's treated.
Yes,
Ready to shift gears to our next urgent situation? Cardiac tamponade.
absolutely. Let's dive into this other critical condition.
Now, cardiac tamponade involves the heart's protective sac,
Right,
the pericardium.
right. Imagine the heart as a fist encased in a balloon.
Okay.
That's your pericardium.
Yeah.
Now imagine that balloon starts filling with fluid,
Right.
specifically blood. As it fills, it starts squeezing the heart, preventing it from filling with blood properly.
So the heart, unable to fill with blood, can't effectively pump blood to the rest of the body.
Exactly.
I can see why this is considered a major emergency.
Early recognition is critical.
Right.
Symptoms may include muffled heart sounds,
Okay.
low blood pressure,
Uh-huh.
and distended neck veins. Those are the telltale signs we watch for.
Right.
Prompt diagnosis and treatment are absolutely essential for survival.
Hmm.
It's like trying to fill a water balloon
Right.
that's already full.
Mm-hmm.
The pressure builds, and the heart simply can't expand
Okay.
to take in more blood.
So the heart is essentially being strangled
Yes,
by the fluid building up around it.
exactly. And as you can imagine, that's a very serious situation
Right.
that can quickly become fatal if it's not addressed
Right.
immediately.
Let's talk about what causes this fluid buildup
Okay.
in the pericardium.
Sure.
What are some of the common culprits?
Trauma is a frequent cause.
Oh.
Think of a penetrating injury like a stab wound
Right.
to the chest that damages the heart or the surrounding blood vessels.
So something that directly impacts the heart
Right.
or the area around it.
Right. But trauma isn't the only cause.
Okay.
Sometimes it's a complication of other medical conditions.
Okay.
For example, certain infections or cancers can lead to inflammation and fluid buildup in the pericardium.
So it's not always a sudden traumatic event. It
Yeah.
would be a more gradual process
Yeah,
related to an underlying illness.
that's an important point.
Mm-hmm.
And it highlights why a thorough medical history
Ah.
and examination are crucial when someone presents
Right.
with symptoms suggestive of cardiac tamponade.
Now, we've talked about the causes and the dangers,
Yes.
but what about the treatment?
Mm.
How do you actually relieve that pressure on the heart?
The most immediate treatment is a procedure called pericardiocentesis.
Okay.
It involves using a needle to drain
Right.
the excess fluid from the pericardium.
So essentially, you're going in and releasing the pressure
Precisely.
that's constricting the heart.
It's often done with ultrasound guidance
Okay.
to ensure accuracy and safety.
Makes sense.
It's a relatively quick procedure,
Right.
but it can be truly life-saving.
I can imagine it would be.
Yeah.
Are there any longer-term treatments for cardiac tamponade?
Well,
Or is pericardiocentesis usually the definitive solution?
pericardiocentesis addresses the immediate problem,
Yeah.
that dangerous buildup of fluid.
Right.
But sometimes the fluid reaccumulates,
Mm-hmm.
or the underlying cause needs further attention.
So you might need to repeat the procedure
Uh-uh.
or address the root of the problem.
Exactly. For example, if the tamponade is due to an infection,
Okay.
antibiotics would be needed. Or if it's caused by a tumor,
Right.
surgery might be necessary to remove the tumor.
It makes sense. Treat the immediate crisis and then tackle the underlying issue.
Right. The approach is tailored to each individual patient
Okay.
and the specific cause of their tamponade.
Right.
There's no one-size-fits-all solution.
This has been incredibly insightful. We've covered so much ground.
Yeah.
Just to recap,
Yes.
we started by exploring flail chest,
Right.
a condition where multiple rib fractures create an unstable segment of the chest wall, leading to breathing difficulties and potential lung injury.
Yes.
We discussed the importance of immediate intervention,
Right.
including pain management, oxygen therapy, and potentially even intubation.
And we even touched upon the possibility of surgical rib plating
Right.
to stabilize the chest wall in more severe cases.
Then we delved into the world of cardiac tamponade,
Mm-hmm.
where fluid buildup around the heart constricts its ability to function properly.
Exactly.
We learned about the various causes,
Right.
from traumatic injuries to underlying medical conditions, and the urgent need for pericardiocentesis
Right.
to drain the excess fluid and relieve the pressure on the heart.
We also emphasize the importance of addressing the root cause
Right.
of the tamponade to prevent recurrence
Exactly.
and ensure long-term stability.
It's been a fascinating journey through these two critical medical conditions.
It has.
Hopefully you now have a deeper understanding
Yeah.
of what makes them so dangerous and why rapid intervention is so vital.
Absolutely. These are conditions where time is truly of the essence.
Right.
Early recognition and prompt action can make all the difference.
And speaking of action, what are some key takeaways for our listeners out there
Okay.
who might be first responders or healthcare professionals?
Sure.
What should they remember about flail chest and cardiac tamponade?
For flail chest, remember those ABCs?
Okay.
Airway breathing and circulation.
Okay.
Support breathing, manage pain, and watch closely
Right.
for any signs of deterioration. And don't forget about the potential need for intubation and even surgical intervention in certain cases.
And for cardiac tamponade,
Yes.
what are the crucial points to keep in mind?
Be vigilant.
Okay.
If you see those classic signs,
Uh-huh.
muffled heart, sounds low blood pressure,
Right.
and distended neck veins, don't hesitate to act. Pericardiocentesis can be a life-saving procedure. Early intervention is paramount.
It sounds like a good rule of thumb for both of these conditions is when in doubt, act quickly.
Exactly. It's always better to err on the side of caution when dealing with potentially life-threatening situations.
It's fascinating how these two conditions, flail chest and cardiac tamponade, both demand such immediate attention. They seem very different, yet that urgency is a common thread.
Absolutely. It really underscores the critical nature of these conditions. Every second counts when you're dealing with a compromised airway or a heart that's being squeezed.
We've talked about the immediate interventions, but what about the bigger picture? Let's say someone has successfully recovered from either flail chest or cardiac tamponade. What does their long-term recovery look like?
That's an important question, and it really depends on a few factors: the severity of the initial injury, the individual's overall health, and how quickly treatment was initiated.
So someone who had a minor flail chest was otherwise healthy and received prompt care might have a smoother recovery compared to someone with a more complex case.
Exactly. For flail chest recovery often involves a period of pain management, pulmonary rehabilitation to strengthen the lungs, and potentially even physical therapy to regain full chest wall mobility.
Well, what about cardiac tamponade? What kind of long-term implications might someone face after that?
Again, it varies. If the tamponade was caused by a traumatic injury, there might be scarring or damage to the heart that requires ongoing monitoring. If it was a complication of another condition like an infection or cancer, managing that underlying cause becomes paramount to prevent recurrence.
So even after the immediate crisis is averted, there's still a journey ahead. It's not just about treating the condition itself, but also addressing those potential long-term effects.
Precisely. And this is where patient education and follow-up care play a vital role. It's about empowering individuals to understand their condition and actively participate in their recovery.
This has been such an insightful deep dive into flail chest and cardiac tamponade. Hopefully you now not only recognize the urgency of these conditions, but also have a better grasp of their potential long-term impact.
And remember, while this deep dive has provided you with valuable knowledge, it's always best to consult with qualified healthcare professionals for any health concerns. They can provide personalized guidance and address your specific needs.
Thanks for joining us on Deep Dive Daily Dose of Case Discussions from Medvarsity. Until next time, stay curious and keep learning.